Okay, this video is patient with an inflamed gut. So the typical situation is one of my friends or a friend of a friend will tell me about themselves or someone in their family or their close friends who has a problem, and I'll talk to them. Okay, so this lady, her 30-year-old son is having severely inflamed gut. He had had a colonoscopy in the past with a severely inflamed colon, and he's having worse recurrent episodes of bloating, pain, cramping, diarrhea, and he's quite sick. He's getting ready to go back to gastroenterologist. And I said, what are they going to do? They're going to scope him from above and below. They're going to do some biopsies, see what that shows. They're going to recommend some pills, maybe some different types of supplements, probiotics or something. And eventually, he'll improve a little bit from the pills, but he's still going to be sick. Then they're going to refer him to a surgeon. Surgeon's going to take out part of his small bowel or his colon, and he'll probably again improve for a while, but he's going to be sick the rest of his life, and probably have recurrences, possibly end up with small bowel obstructions, chronic intermittent abdominal pain, etc. I said, some of the things he should do, he might need to go to a gastroenterologist, certainly. I don't know how sick he is exactly. I said, I didn't speak to him directly. I said, go to drmcdougall.com, read the testimonies. You'll see all these patients that were cured. Crohn's disease, ulcerative colitis, irritable bowel syndrome, etc., and other intestinal complaints. And he could have some rare disease, but most of the people, it's the same old stuff. They're just eating a terrible diet, especially young people. Start learning about inflammatory diseases, Crohn's disease, ulcerative colitis, irritable bowel syndrome, etc., allergies. Eat a low-fat vegan diet. So the good gut bacteria, if you eat a good, healthy, plant-based diet all the time, there's basically two types of bacteria in the colon. There's good bacteria, bad bacteria. Good bacteria feed on fiber. Bad bacteria feed on all this other stuff. So you eat the whole plant foods, you get the fiber. There's no fiber in animal foods, very little in processed foods. And then the good gut bacteria just take over the colon. They dominate. The reason why a person will often have intermittent cramping, bloating, diarrhea is because there's a turf war in the colon fighting over which bacteria are going to dominate. If you just feed the good guys with the whole plant foods, then they dominate. There's no turf war. Your gut calms down. It just does what it's supposed to do. And how do you know what you're supposed to eat? Just think about it. We're designed to eat low-fat plant foods. Our ancestors, what did they do all day long? They walk around in extended family groups looking for something to eat, which is going to be plant foods. We don't got big claws. We don't got big sharp teeth. Okay, let's see, what else? Avoid the things that cause leaky gut. I gave them previous lectures on that and listed about 50 things that cause leaky gut. Avoid all that stuff. A lot of it's pretty obvious. Alcohol, cigarettes, excessive psychological stress, sleep deprivation, caffeine, high-fat diets, mercury, fluoride. So you got to reverse osmosis filter your drinking water. Also, the aluminum and the mercury are real toxic to your gut. So is the chlorine. It's toxic to your gut too. Tap water is designed to irritate your gut. Eat the low-fat vegan diet with organic only because there's toxic chemicals in there. Glyphosate's a big cause of gut irritation. And a lot of what people think is celiac and sprue and all that stuff is really due to glyphosate. No caffeine, improve your sleep, get your exercise, get your sunshine, do all that stuff. And you can consider trying the elimination diets of Dr. McDougall, etc. But, start learning about your disease so you can take an active role in improving your health rather than just being a passive victim. That's a weak thing to be. A patient who's involved and motivated and experimenting with changes, that's a strong person who's got a very good chance to get better or be cured. So anyways, that's the patient with the inflamed gut, one way to approach it, what I would do if it was me.